Thanks for staying with us. There's been another notable rise in South Africa's daily COVID-19 infections after 4,230 tests came back positive. That's over the last 24-hour recording period. It raises fears that the country may well be on the cusp of a fifth wave. Joining us to determine whether our fears are well-founded at all is Gauteng Coronavirus Command Council member, Professor Bruce Mellado. Professor, very good evening to you. Thank you so much for your time. Could we be on the cusp of a fifth wave?
First of all, thanks for having me. So as you correctly point out, we have seen a strong acceleration in the number of cases starting on Wednesday this week. So we've seen relatively high numbers compared to the previous baseline for about half a week. And very importantly, we also see a strong acceleration in the positivity rate. As of yesterday, the positivity rate has surpassed 20%, where the threshold is about 10%. But most importantly is the tendency for the positivity rate to increase, which is certainly worrisome. We have also seen, even though there is a delay between the number of cases growing and hospitalization, we have seen in the past 3 days that the number of hospitalizations has increased by about 10%. Severe hospitalization is still difficult to judge because the numbers are still small, and we are at the very beginning, at the very onset of the surge. But we see also increase in number of patients that need oxygenation or ventilation or end up in the ICU. So clearly, even though we are obviously looking at the data on a daily basis, and it is early to conclude or to declare a new wave, it is likely that this surge may be related with a fifth wave.
We're heading into the colder winter months, which also raises some concern and also questions around the variant. I mean, is a new variant emerging, or are we still dealing with Omicron?
Right. So you asked two very good questions. So first of all, because we are clearly in cold weather, especially in the mornings when we go into public transportation, windows are not open, so ventilation is poorer. As we have seen on previous occasions and previous waves that took place in winter, public transportation has always played a very important role in transmission, especially in cold weather. So it is essential, and we believe, as we have always believed, that we have to follow the current regulations that we have in place, whereby people have to wear masks indoors, especially if you go into a closer space such as public transportation, and this certainly needs to continue. We have seen in the past that public transportation was a major driver of community transmission as people move quite significantly. Mobility overall in the province remains at a very high level, similar to the levels of mobility we had before the advent of the pandemic. So that clearly is not going to help, and we're dealing with strains that are very contagious. Now, pertaining to your question of the evolution of the Omicron variant, we hear from experts and our genomics team in South Africa that we have now 5 of them. They are in continuous evolution. Mutations continue to take place, and certainly this doesn't help either. That increases the uncertainty that modeling has in order to vis-a-vis its ability to predict. So we are in a situation we have to follow the numbers extremely closely, and we need to ascertain whether this surge is in any way different compared to the fourth wave. If there are differences, which differences we have, so that we can react as quickly as possible.
Could we find ourselves in an instance where a new wave is driven by a past variant?
Well, what we see, and again, I'm not an expert in that particular area, but what we do is we basically look at the input that experts in genomics give to us. And looking at the past experience, we see that the pandemic is driven by new variants and subvariants that take over older ones because they have become more transmissible. And it's sort of like a well-understood process from the physical standpoint. When you have a new variant or a new subvariant that is more transmissible than the previous one, then it overtakes old ones. So we see is basically a continuous replacement of variants and subvariants by those that are more contagious.
Where are we standing now with the increase and the expectations around a further relaxation of COVID-19 regulations?
Right. So this very sudden increase that has taken place as of Wednesday, of course, raises red flags as to where we are. And we see at least the first data is too early to judge. It's only half a week. But we are seeing that the acceleration or the rate of growth of community transmission doesn't seem to be as high as during the fourth wave, but it is too early to conclude. We certainly are in a very serious situation. Remember, in terms of hospitalizations, the fourth wave reached quite a big number. It was 4,000 beds at peak, and that is certainly not something that we need to sneeze at. That's a very big number, and a tremendous pressure on the hospital system, public and private systems. So the modeling that we've been developing so far indicates that the fifth wave would be slightly less impactful, but similar to the fourth wave, and that means that we may have quite a number of people in hospital. Currently, we are basically at the level of 1,270 as of yesterday, with a significant increase over the past 3 days. So that certainly implies that there's going to be a very serious pressure on the hospital system. So we urge everyone to adhere to the social distancing measures that are still in place, in particular indoors.
Very well. Thank you so much for weighing in on this discussion. Gauteng Coronavirus Command Council member, Professor Bruce Mellado, speaking to a word of caution when it comes to the rising numbers of COVID-19 and the continuation of adhering to some of those rules when it comes to wearing of masks and social distancing.